Have you ever wondered what happens inside your body when a natural part of your health routine suddenly disappears? This is something many doctors avoid discussing during a regular checkup, but it deserves attention. If you've stopped masturbation as you've gotten older, your body may be responding in ways you don't even notice yet. And no, this is not about rumors, myths, or uncomfortable conversations. This is about understanding your body, your hormones, your mental health, and the way your systems continue to function as you age. I'm Dr. Jocelyn, a urologist and men's health specialist with years of experience helping older adults understand the changes happening inside their bodies. Today, I want to explain what may happen when sexual self-care disappears from your life, and why this topic is connected to much more than just pleasure. Before we begin, make sure to like this video, share your thoughts in the comments, and subscribe so you can keep learning simple, practical ways to protect your health, confidence, and independence as you get older. Here is something many people don't realize. Masturbation is not simply a habit connected to youth or desire. For many adults, it can be part of maintaining normal body function. It may support hormone balance, prostate health, brain chemistry, sleep patterns, and emotional well-being. And when this part of your routine completely disappears, some changes may slowly develop over time. In my medical practice, I have seen many older men who are physically active, mentally strong, and proud of how they take care of themselves. But there is one thing they often overlook. They stop paying attention to their intimate health. They assume it no longer matters. But your body does not work that way. Sexual function is connected to many systems. Your prostate, your pelvic muscles, your nervous system, your circulation, your hormones, and even your emotional state are all linked together. Think of it like a small maintenance process that helps your body stay balanced. So today, let's talk about 7 important ways stopping masturbation later in life may affect your body, your mind, and your overall quality of life. Let's start with the first one. The first major change is decreased prostate health and urinary function. I remember a patient in his early 70s. He was active, healthy, and mentally sharp, but every night he was waking up 4 or 5 times just to use the bathroom. He couldn't understand why. One thing many men don't know is that regular ejaculation, including through masturbation, can help the prostate release built-up fluid. When ejaculation becomes completely absent for long periods, some men may experience changes in prostate comfort and function. This can contribute to feelings of pressure, irritation, or urinary difficulties. You might notice that your bladder doesn't feel completely empty. You might experience a weaker urine stream. Or you may simply feel discomfort that wasn't there before. And the effects are not only physical. Imagine waking up several times every night. Your sleep becomes interrupted. Your energy drops. You start worrying about being far away from a bathroom. Slowly, something as simple as going outside or traveling can start feeling stressful. Regular ejaculation is one part of maintaining prostate function, along with other healthy lifestyle habits. It is not a replacement for medical care, but it can be one factor that supports overall men's health. The second major consequence is changes in mental clarity and focus. Another patient in his late 60s once told me, "Doctor, I don't feel like myself anymore. I walk into rooms and forget why I'm there. My mind feels different." And this is something we need to understand. Sexual activity influences the release of chemicals in the brain, including dopamine, serotonin, and oxytocin. These chemicals play a role in mood, motivation, emotional balance, and mental sharpness. When sexual activity completely disappears for a long time, some people may notice changes in their emotional state and concentration. They may feel less motivated, less confident, or simply not as mentally active as before. I've seen people lose interest in hobbies they once loved. One person stopped attending his regular chess group because he felt unable to concentrate. Another retired teacher told me his mornings felt empty, like his mind took longer to fully wake up. These changes may seem small at first, but over time, they can affect your daily life, relationships, and how connected you feel to yourself. The third major consequence is increased emotional stress and a feeling of numbness. I once worked with a 72-year-old man who had lost his partner. During our conversation, he said something that stayed with me. He told me, "I don't really feel anything anymore. I'm not exactly sad, but I'm not happy either. Everything feels flat." This is something many people experience as they age, and there can be many reasons behind it. But one factor that is often ignored is the connection between your body and your emotional health. Masturbation and sexual activity can stimulate the release of natural chemicals like endorphins and oxytocin. These chemicals are involved in stress relief, relaxation, emotional connection, and feelings of well-being. When that connection with your own body disappears completely, some people may notice that they feel more disconnected emotionally. They may lose interest in things they once enjoyed. They may withdraw from social activities. Even simple daily routines can begin to feel more difficult. And when emotional health starts declining, it can create a cycle. Poor mood affects sleep. Poor sleep affects energy. Low energy affects motivation. And slowly, a person may start feeling like they are no longer the same person they used to be. Of course, depression is a medical condition and should always be taken seriously. Therapy, support, and professional treatment can be extremely important. But reconnecting with your own body and practicing healthy self-care can also play a role in rebuilding confidence and emotional balance. The fourth major consequence is poorer sleep quality. Sleep is one of the foundations of healthy aging, but many older adults struggle with falling asleep, staying asleep, or waking up feeling refreshed. I had another patient in his late 60s who came to me because of constant tiredness. His medical tests looked normal. His diet was reasonable. His exercise routine was good, but his sleep was broken. During our discussion, he mentioned that intimacy had completely disappeared from his life for years. Now, this does not mean every sleep problem is caused by the absence of masturbation. But there is a connection between sexual release and the body's relaxation response. After orgasm, the body can release chemicals such as oxytocin, prolactin, and endorphins. These signals help shift the nervous system from a state of tension into a state of calm. For some people, this natural process can support better relaxation and sleep. When that part of life disappears, some individuals may experience more restlessness, lighter sleep, and greater fatigue. And poor sleep does not stay limited to nighttime. It affects everything. Your memory can suffer. Your mood can change. Your immune system may become weaker. Your risk of developing health problems can increase. A tired body simply does not function the same way as a rested one. The fifth consequence is weakened pelvic muscles and reduced circulation. Your pelvic floor muscles are extremely important, but many people don't think about them until something goes wrong. These muscles help control your bladder. They support your core. They play a role in sexual function. I once treated a retired firefighter who came in because he was experiencing urinary leakage and discomfort around his lower back and hips. He was surprised when I explained that his pelvic floor muscles were not working as effectively as before. Masturbation naturally involves contractions of these muscles. In a way, it creates movement and stimulation for an area that many people forget to maintain. Without regular activity, some muscles can become weaker over time. And when pelvic muscles weaken, you may notice changes. Small urine leaks, a feeling of less control, discomfort when standing or moving, or changes in sexual response. Emotionally, these issues can be frustrating. Many men feel embarrassed. They feel like their body is no longer cooperating with them, but the reality is that the body responds to care, movement, and attention at every age. Your muscles need activity. Your circulation needs support. Your nervous system needs stimulation. Your body is not something you stop taking care of just because you get older. The sixth consequence is a possible impact on immune function and inflammation control. Your immune system is one of the most important defense systems in your entire body. It works every day to protect you from infections, control inflammation, and help your body recover when something goes wrong. Many people don't realize that sexual activity can interact with the immune system in different ways. Research has shown that sexual activity may influence immune markers, including certain antibodies like immunoglobulin A, which plays a role in defending against germs. Now, this does not mean masturbation is a magical cure or that stopping it will immediately make you sick. The human body is much more complicated than that. But when a person removes an activity that may support relaxation, hormone balance, and stress reduction, there can be changes in how the body handles stress. And chronic stress itself can affect immune health. In my practice, I've seen older adults who feel constantly tired, recover more slowly from illnesses, or struggle with ongoing inflammation. Sometimes the answer is not one single thing. It's the combination of sleep, movement, nutrition, emotional health, and how connected a person feels with their own body. Small habits can create big differences over time. The seventh and final consequence is something many people never talk about. It is the loss of connection with your own body and a decline in self-worth. This is not just about sexual activity. This is about how you view yourself. I once had a patient in his late 70s who said something very powerful. He told me, "I feel like I'm only living inside my body, but I'm not really connected to it anymore." That statement explains something important. Your relationship with your body affects your confidence, your emotions, and the way you care for yourself. When people completely ignore their physical needs, they may slowly become disconnected. They may stop paying attention to changes. They may stop caring about their comfort. They may feel like aging means losing control. But aging does not mean giving up your relationship with yourself. Healthy self-touch, personal care, and understanding your own body can remind your nervous system that you still matter. Your body still deserves attention. Your health still deserves protection, and your quality of life is still important. So now the question becomes, what can you actually do? The first thing is to remove guilt and shame from the conversation. Many people were raised to think that discussing sexual health is embarrassing. But as a doctor, I can tell you that understanding your body is a normal part of taking care of yourself. Self-care does not have an expiration date. The goal is not obsession. The goal is balance. Consistency matters more than frequency. You are not trying to prove anything. You are simply supporting your body. Pay attention to your pelvic floor muscles. Simple pelvic floor exercises, often called Kegel exercises, can help support bladder control and muscle function. These muscles are just like any other muscles in your body. If you never use them or strengthen them, they may weaken. But with proper care, they can remain active and supportive. Also remember that intimate health does not exist separately from the rest of your lifestyle. Your sleep matters. Your food choices matter. Your physical activity matters. Your stress levels matter. Everything is connected. A healthy routine is not built from one single habit. It comes from small actions repeated consistently over time. I also want to mention something important. If you notice major changes in your sexual function, urinary habits, mood, or energy levels, do not simply ignore them. Sometimes these changes are signs of underlying medical issues that should be evaluated. A conversation with a healthcare professional can help you understand what is happening and what steps are right for you. There is no reason to feel embarrassed about discussing these topics. Doctors hear these concerns every day. Your health is the priority. And taking care of yourself is not something you should stop doing as you get older. In fact, it may become even more important. Many people believe that aging automatically means losing energy, confidence, and connection with their own body. But that is not the full story. Getting older is a natural process, but how you age depends on the choices you make every day. Your body continues to respond to care. It continues to respond to movement. It continues to respond to attention, and your intimate health is one part of that bigger picture. I often tell my patients that the goal is not to chase the past. You are not trying to become 20 years old again. You are trying to feel comfortable, capable, and healthy in the body you have today. That difference is extremely important, because many older adults make the mistake of thinking that certain parts of life are simply over. They assume that changes in sexual health, energy, or confidence are things they must accept without question. But many of these changes can be improved with the right understanding and the right habits. Your body is always communicating with you. The problem is that many people stop listening. A small change in sleep, a difference in mood, a change in urinary patterns, a decrease in energy. These things may seem unrelated, but sometimes they are connected. This is why paying attention to your overall health matters. A healthy body is not only about avoiding disease, it is also about maintaining function. It is about staying independent. It is about waking up and feeling like yourself. And that includes taking care of areas people often ignore. For men especially, prostate health, hormone balance, pelvic strength, circulation, and emotional well-being all work together. When one area changes, other areas can sometimes be affected too. This is why a complete approach is so important. Think about your body like a machine that needs regular care. You would never expect a car to run perfectly for decades if you ignored maintenance. The same idea applies to your health. Small actions done consistently can prevent bigger problems later. That does not mean you need to become obsessed with every detail. It means becoming aware. It means noticing what your body is telling you. It means making choices that support your future self. Another important point is confidence. Many men silently struggle because they feel their body is changing in ways they cannot control. They may feel embarrassed to talk about it. They may avoid conversations with their partner. They may even avoid seeing a doctor because they think nothing can be done. But silence usually makes problems feel bigger. A simple conversation can sometimes bring relief. It can help you understand whether something is normal aging or something that needs attention. As a urologist, I see this all the time. Patients often wait months or years before asking for help because they feel uncomfortable. Then they realize they should have asked much earlier. There is no weakness in wanting to understand your own body. There is no shame in protecting your health. In fact, it is one of the smartest things you can do. Your physical health and emotional health are deeply connected. When you feel better physically, you often feel better mentally. When you take care of yourself, your confidence improves. When your confidence improves, you become more active and engaged with life. It becomes a positive cycle. This is why intimate health should not be viewed as a separate or embarrassing topic. It is simply another part of human health, just like your heart, just like your muscles, just like your brain. Your body deserves care from every angle. So if you have stopped paying attention to this part of your health, today is a good day to start becoming aware again. Not with fear, not with guilt, but with understanding. Your goal is not perfection. Your goal is balance. Your goal is to support your body so you can continue living with freedom and confidence. Because the truth is, your best years are not only behind you. With the right habits, knowledge, and self-care, you can continue building a healthier future at any age. The most important thing I want you to remember is this: your age does not decide your vitality. Your daily choices do. The way you sleep, the way you move, the way you manage stress, the way you care for your body. All of these small decisions add up over time. And when it comes to intimate health, understanding your body is one of the most valuable forms of self-care. Many people spend years taking care of everyone around them, but forget to take care of themselves. They focus on work. They focus on family. They focus on responsibilities. And slowly, they ignore the signals their own body is sending. But your health should not be something you only think about when a problem appears. Prevention matters. Awareness matters. Listening to your body matters. If you notice changes in your urinary habits, your mood, your sleep, your energy, or your sexual health, don't simply assume it is just because you are getting older. Sometimes your body is asking for attention. And sometimes, a small adjustment can make a big difference. Rebuilding a healthy relationship with yourself does not require complicated solutions. It starts with simple steps. Move your body regularly. Eat in a way that supports your health. Sleep as well as you can. Reduce unnecessary stress. Stay socially connected, and do not ignore your personal well-being. Your body is not your enemy. It is your partner. It has supported you through every stage of your life, and it deserves the same care and respect in return. I know conversations like this can feel uncomfortable. Many people were never taught how to discuss these topics openly. But avoiding a subject does not make it disappear. Education gives you control. Understanding gives you confidence. And taking action gives you the ability to protect your future health. This is not about returning to your younger years. It is not about chasing the past. It is about feeling strong, comfortable, and connected today. A healthy life is not measured only by how many years you live. It is also measured by how well you live those years. Your confidence, your independence, your energy, your ability to enjoy life. These things matter. So if you learned something valuable from this video, make sure to like it, subscribe for more health-focused content, and share this with someone who may benefit from hearing it. And I would love to hear from you. Where are you watching from? Have you noticed changes in your health as you've gotten older? Your experience might help another person feel less alone. Remember, aging is not the end of your strength. It is simply another chapter where taking care of yourself becomes even more important. Small, consistent actions can protect your comfort. They can support your confidence. And they can help you stay connected with the person you have always been. Your body, your mind, your life. Start taking care of them today.